Excellency Madam Shiranthi Rajapaksa, Honorable K.D. Ramukalla, the Minister of Health and Nutrition, Sri Lanka, Professor Sir Sabaratha Marulkumaran, Emeritus Professor of Obstetrics and Gynaecology at St. George's Hospital, Dr. Lakshman Senanayake and Madam Dr. Geeta Senanayake, Professor Indraji Amarasinghe, Patron of SLCOG, Dr. Pradeep de Silva, outgoing President, Professor Hemantha Dulampahala, President-elect, respected past presidents, fellows, members, and invited guests, ladies and gentlemen, good evening. I am honored and privileged to stand before you as the 36th President of the Sri Lanka College of Obstetricians and Gynaecologists in this historic evening. I wish to thank the members of the SLCOG for electing me as the 36th President for the year 2022. I would like to thank immediate past President Dr. Pradeep de Silva and his council and all the past presidents for their excellent contribution to improve maternal and women's care during past 5 decades of the history of SLCOG. I hope I would be able to continue the good work of Dr. Pradeep de Silva and all the past presidents to fulfill aspiration of the membership. I am also fully aware the commitment and dedication of past presidents in achieving targets and what we are today. I will also maintain high standards of the office for the betterment of maternity care and actively promote postgraduate education in Sri Lanka during my tenure in office. When I joined the SLCOG 16 years ago, I have to thank Dr. Ajitha Vijayasundara and my guru, Dr. Lakshman Senanayake, for signing up my application for being a member of SLCOG. Thank you very much, both of you gentlemen. And SLCOG was established as the Ceylon Obstetric and Gynaecological Association in 1953 with the presidency of Dr. Mrs. May Ratnayake. 24 years after the establishment of Royal College of Obstetricians and Gynaecologists. Later, in 1967, Professor D.A. Ranasinghe pioneered in forming the Association of Obstetrics and Gynaecology of Ceylon with his presidency. I acknowledge his son, consultant anesthetist Dr. Ranasinghe is in the audience, and the organization opened membership and became a well-recognized institution in 1967. In 1970, the association was elevated to the status of college and became known as Ceylon College of Obstetricians and Gynaecologists. Finally, with the adoption and enactment of the Constitution of the Republic of Sri Lanka in 1972 by the Constituent Assembly, the organization came to be called Sri Lanka College of Obstetricians and Gynaecologists. Improvement in healthcare should happen at institutional level, not at field level. Therefore, we clinicians who are members of the college have a bigger role to play if we are to achieve these targets. Scientific analysis of morbidity and mortality by the professional colleges by the way of confidential inquiries will help to identify the root cause analysis and to decide on the strategies. Ladies and gentlemen, very often these problems are based on geography, hospital-based, and unit-based. Ministry should empower the colleges in order to achieve these targets. Sri Lanka, being a middle-income country with per capita GDP of $3,682 in 2020, has indicators that reflect satisfactory overall health status of the population. The infant mortality rate and the maternal mortality rate in Sri Lanka are among the lowest in Southeast Asian region. We are the best in Southeast Asia when we compare the maternal mortality rates. Maternal mortality ratio is 30 deaths per 100,000 live births in 2020, provisional reports. The objective of maternal death surveillance and response, MDSR, is to improve maternal health and to end preventable maternal deaths. Sri Lanka MDSR mechanism was introduced in 1981. by the issue of Gazette regulation on mandatory notification of probable maternal deaths. The process is structured. Review of maternal death in collaboration with SLCOG was started in 1995. Numerous quality indicators were added time to time and up to now. Maternal mortality ratio is the widely used measure of maternal death, and in the way back of 1947, Sri Lanka recorded maternal mortality ratio of 1,694 per 100,000 live births. Gradually reduced to achieve the best maternal mortality ratio in the South Asian region, the reduction of the Sri Lanka maternal mortality ratio is impressive, yet are we satisfied? During the last decade, the maternal mortality ratio is stagnating around 32 per 100,000 live births. Therefore, we have to revisit the system of MDSR. And SLCOG would like to propose the internationally accepted system of confidential inquiries into maternal death. Honorable Minister of Health, we need to change the system of assessing maternal death to achieve a single-digit maternal mortality ratio. SLCOG has taken initial steps under Dr. Mangala Disanayake to carry out the pilot project in collaboration with the Family Health Bureau during the presidency of Dr. Pradeep de Silva. Therefore, I may propose you to introduce this new system nationally once pilot project is over with the help of the Family Health Bureau. This will be way forward to reduce the maternal mortality ratio further. In the year 2020, there were 91 reported maternal deaths and maternal mortality ratio was 30 per 100,000 live births. It is notable, although number of maternal deaths were reduced compared to 2019, there was a substantial reduction of live births in the year 2020. Honorable Madam, in Sri Lanka, at present, there are births are getting reduced by 10,000 per year. Our population is depleting. Every year, we are seeing reduction of live births 10,000 each year. This is a very important area for the policy planners to think of, since population of Sri Lanka is reducing and it will cause significant impact on the economy of Sri Lanka in the years to come. There's a remarkable change in the pattern of maternal mortality ratio in 2020. According to the SLCOG records, the highest number of maternal deaths were reported in Gampaha district and 0 maternal deaths were reported from 3 districts, Hambantota, Mullaitivu and Vavuniya. Therefore, Sri Lanka's initial maternal mortality ratio 85 per 100,000 live births in 1990 has come to now 32 per 100,000 by 2020. This is on track to meeting the MDG target of 21 per 100,000 maternal deaths by previously suggested year 2015. Few countries in the region achieved health indicators of MDG goals. It is interesting to find out why this was not achieved and despite having well-structured health system. The role of non-governmental international organizations, UNFPA, WHO, FIGO, and there are a lot of other non-governmental international organizations are to support the improvement in maternal and newborn care programs. We have to decide on strategies, policies, and identify the bottlenecks and minimize inequalities in the deprived segment of the services. 2030 Agenda of Sustainable Development, which has 17 Sustainable Development Goals. Mainly SDG 3 is concerned with maternal and child health. Under the SDG 3, there are 13 core indicators and 38 health indicators related to maternal death and child health. Obstetricians will have to really work hard to achieve the Sustainable Development Goal. From the maternal mortality ratio, I'm going to draw your attention in my presidential speech. The other very important and neglected area, that is the subfertility. This has become a major issue in Sri Lanka. And as you are aware, 7 to 10% of couples are waiting to get the IVF treatment. At present, there are no consensus about IVF pregnancies. We, as obstetricians and then the neonatologists, we are facing the worst outcome of unregulated IVF programs. Worst outcomes have an impact on increasing maternal mortality and increasing neonatal mortality rates. Ladies and gentlemen, we have experienced maternal deaths due to IVF pregnancies of mothers with multiple comorbid factors and advanced maternal age. The cost of extreme prematurity is an enormous burden to healthcare system. SLCOG is in the view of establishing a regulatory authority for artificial reproductive technologies. Therefore, SLCOG, in collaboration with Attorney General Department and Family Health Bureau, has drafted the Human Reproduction and Genetic Act. The field of genetics and reproduction had once again been brought together. In the modern day, there's a cross-border gametes transferring, and there are a lot of new things have come, but we have no regulation over anything of genetic material transferring. The principal aim of the Act was now to establish a Human Reproduction and Genetic Authority in Sri Lanka. I hope to give my fullest support during my tenure in office for this project. Again, members of the SLCOG helped to establish Master of Surgery in Gynaecology and Obstetrics through the PGIM in 1984, and subsequently it was changed to MD, Doctor of Medicine, in 2001. With increased intake of trainees, the MS in Obstetrics by PGIM has resulted in expansion of services up to base hospitals and upward now. This has resulted 24 hours consultant coverage for pregnant mothers in Sri Lanka. I will continue to support PGIM to promote postgraduate education in Sri Lanka and to reshape, as our immediate past president, Dr. Pradeep de Silva, mentioned in his speech, we have to regulate this postgraduate training in the coming years. Then our flagship program, Safe Motherhood Initiative, which was launched in Nairobi in 1987, is being rolled out in outstation hospitals to improve the quality of obstetric emergencies. The SLCOG conducted its first Safe Motherhood program in Anuradhapura in 1991, and second in Matale, sponsored by UNICEF in 1992. SLCOG has continued to conduct Safe Motherhood programs every year regularly across the country, facilitate policy dialogue with the health administrators at local levels. SLCOG is proud to have sustained good practice initiated by the global program. Health department should take the lead of update the staff and try to improve the maternal and child health services. Professional colleges should formulate the modules depending on the need. They should play the advocacy role. Clinical leaders, with the support of Director of Hospital and Quality Assurance Department, should facilitate these modules. All the benefits should go to the junior staff in the hospital who need clinical training, and this intervention will support them to improve the quality of care. I believe team dynamic training is the focus now, not individual training model. I have planned to commence SHO training program, which was initiated by Dr. Ananda Ranatunga during his presidency 2011. And sir, you are in the audience, and I acknowledge you, and you have started this program. And during my tenure in office, I thought to start it again, and it was there, but I wanted to start it again. And we have a dynamic people like Rasika, and then Gayan, and then Sanjeeva, and then a lot of young chaps have promised me to help to come forward and start this SHO training program. This program will be supported by the Ministry of Health under the guidance of Dr. Hemantha Herath, Director of the In-Service and Individual Training Program. Dr. Pradeep de Silva and myself, we had the initial discussion with Dr. Hemantha Herath, and it was quite positive, and I'm sure we can start this SHO program, training program, which is initiated by Dr. Ananda Ranatunga. that will benefit our middle grade medical officers. That will improve the quality of care in years to come for providing maternal services. Whether it is driven by the Ministry of Health or by the consultant in the respective field or as a college is a question that needs to be explored. This remark applies in our context as I strongly feel members of the professional colleges contribute to improve the national statistics, and it is not data-driven improvement. During the COVID-19 pandemic, all of us, we worked hard. All the college members, my sincere thanks goes to all the colleges, our SLCG members, and my special thanks go to Dr. Mayramana and Achinta Dishanayaka. They were very, very positively and they were in the forefront managing the COVID positive mothers. Thank you very much for both of you for your commitment on behalf of the SLCOG. Care provision has had to be modified and maternity units have faced many new issues. The effect of these changes on the maternity outcome have not yet been measured, and it is unclear whether these changes have widened or narrowed existing inequalities in the care provided by the COVID-19 pregnant mothers. SLCOG considered audit and research as an important of clinical excellence. Ministry of Health supporting clinicians to engage in clinical research, and Ministry of Health issued the Management Services Circular number 45 on payment of research allowance as per the budget proposal 2014 in order to provide financial support for the researchers. I have planned to establish a Center of Research Facilitation under the guidance of senior college members, and the objective of this Center for Research Facilitation is to improve the research culture among clinicians, especially the clinicians in the Ministry of Health, and we really have very minimum facilities, minimum time to engage in, and the guidance to engage in research work. So I am planning to establish this center and provide guidance and training in research. And this center will provide support and training for grant applicants for the research and infrastructure development, and it provides mentoring for researchers and training and supporting researchers to publish their research work, and training and supporting research entrepreneurship. When I was working with my trainer, Dr. Lakshman Senanayake, I was fascinated by the pioneering work he has done. He is a true human being, and he had a very sympathetic corner for these mothers who face domestic violence. At that time, it was an unspoken subject, and I helped him as his senior registrar. There was a small room in his ward, that is ward number 9 and 10, now Castle Street, and nobody supported him. It is only who supported his trainees. Even the administrators thought those days, this is not relevant, this is unspoken. Now, the authorities have taken very serious note on it and passed legislations and started Mitru centers all over the country to look after the women and pregnant mothers who are the victims of domestic violence. So I have been continuously engaged in work on violence against women and hope to continue during my tenure in the office, respecting my teacher, Dr. Lakshman Senanayake. At last of my speech, I would like to extract a quote by Anthony Leo. I quote, "Healthcare delivery has worked as well as it has developed to date because of clinicians are bright, hardworking, and well-intentioned, not because of the good system, design, or systematic data use," unquote. As the 36th president of SLCOG, I pledge my fullest support for these programs during my tenure in office, and I will help them to launch this at national level. I will be failing in my duty if I don't mention anything about the Ladies Forum, which was started by the wife of Dr. Ananda Ranatunga in the way back of 2011, and it has gone in a huge success now, and I will give my fullest support for the Ladies Forum to develop their future programs. As the 36th President of SLCOG, and I have to acknowledge the people who have helped me during my career and my family. As the first, I acknowledge their support. Then Mr. P. Nanakara, my school days A-level teacher. Thank you very much, sir. You are in the audience. I acknowledge. Without your guidance, I don't think I will be able to come this far. Then I have to acknowledge my undergraduate teacher, Professor Asoka Gunasekara. Thank you very much, sir. Because of your teaching, I took a liking into obstetrics. I acknowledge you on this audience in this historic day. Then late Dr. Aravinda Gautamadasa, the person who motivated me to this field, and unfortunately he is no more here. Then my trainers, Professor Jayanta Sirisena, Professor P.S. Vijayasinghe, Dr. P.C. Gunasekara, and Dr. Lakshman Senanayake. I was trained under these 4 people during my career, and thank you very much for the guidance and the influence you put on me to make me into this SLCOG presidency today. Then I can't forget Dr. Wana Hattatua. Thank you very much, sir. You have guided me right from the beginning. Maybe 15 years ago, I met you as a very young secretary when I was elected to Dr. Ananda Ranatunga. And you gave me a very valuable advices, and I followed them and I became a successful secretary. But I am not up to you because you are the most successful secretary in the SLCOG, and you have a record of longest served secretary in the SLCOG. Thank you very much, sir. Then I have to thank Professor Sir Sabaratnam Arulkumaran. I had a very close association with Sir Sabaratnam Arulkumaran, and he has guided me, and he never refused when I make any request. Even today, thank you very much, sir, for your brief presence here in spite of very busy schedule. During my SLCOG days, I will be failing in my duty if I don't mention anything about Dr. Mrs. Male Navayavardhana. Madam, you have invited me to join your council in the way back of 2004 when you are the president. And ever since you are encouraging me during ups and downs in life. Thank you very much, madam. And then I can't forget Dr. Ananda Ranatunga. Thank you very much, sir. You have invited me to become your secretary. At that time, I never expect that, but thank you so much. It has come to a wonderful journey and ended up today in my position. Again, I have to thank Dr. Ajiza Vijayasundara, the excellent gentleman in obstetrics and gynecology, and thank you very much for putting me into this track. And there's another gentleman, Dr. Asoka Veerakodi, who was with me all the time, and whenever advice needed, he helped me. Thank you very much, sir. Then I have to thank few of my young contemporaries, Dr. Mangala Disanayaka. Thank you very much, Mangala. You have been with me since my Nuwara days, and we were helped to reduce the maternal mortality in Nuwara and to keep it in this level today. And you are always supporting me. Thank you very much. And at last, there are a lot of people, but I can't take by each and every of them. Then my senior colleague, Dr. UDB Ratnasiri, thank you very much for your guidance and helping me to carry out my duties at the Castle Street Hospital. When I am in trouble, you are always helpful. Thank you so much for your assistance as a colleague. And having said that, I have come to the end of 36th presidential speech, and Thank you very much for your patient hearing, and I wish you all the very good evening and have a pleasant evening. Thank you.